Hello everyone, welcome back to my channel. Today we are going to talk about very important entity called Craniocervical Dissociation, which is usually traumatic. So this entity is really important and it's not very common, but it happens. We have to diagnose it immediately because it has a lot of consequences. So I want to talk about a 3-year-old come to the emergency department after a motor vehicle accident. We usually do the cervical spine and head CT for these kids. Sometimes they straightforward go to the MRI, but we usually get a CT as well in the case that we are just thinking about cervical spine injury. So I just want to make this bigger for you guys to just pay attention. As we see, this is a small kid. As we see these end place vertebral bodies, they are not ossified completely. This is a C2 vertebral body, as you guys see, and it's not completely fused as we expected in this age. So now, when we are talking about craniocervical dissociation, we have to do some measurements. So first of all, this is the Bayesian dense interval from here, from the Bayesian to the dense. As you see here, this measurement is about 14.7 millimeter. So we don't expect this distance more than 10 millimeter in kids on the CT. So this is widened, as you see. There is the other measurement that is atlantodense interval. As you see here, this is the atlantodental interval that is like almost 2.6 millimeter. It's just a little bit wide, and if I just want to make it more accurately, it's going to be actually 3 millimeter. So anything like above 2.5 millimeter is also abnormal here. So it looks like the atlantodense interval is also widened here. This is the powers ratio. I usually just don't draw this one, but just basically based on all this information, we know that there is craniocervical dissociation. I will show you more images, but this is the way that we just measure powers ratio, that if it's more than 1 is also an indication of craniocervical dissociation. So this is like we are already concerned about this, but we just need to go to the coronal view as well. So if you look at the coronal view, you see that this distance between the basically atlanto-occipital joint that is widened, so this distance shouldn't be more than 2 millimeter, but now you see, oh, it's a lot widened than it's just almost 6 millimeter. So basically this is the widening of the atlanto-occipital joint and also lateral on atlanto-axial joints. As you see here, the distance between C1 and C2 lateral mass also widened. So basically atlanto-occipital joint is widened, and then the distance between the C1 C2 lateral mass is widened. It's just 7 millimeter. These distances shouldn't be more than 2 millimeter at most. So basically we see that these all joints that should be very closely aligned in normal situation, they're all widened. So this is very worrisome for craniocervical dissociation, and this is a very serious injury that I'm going to show you in my next video, that what it happens with the cord and what a spinal cord injury we're going to see. So when we see this craniocervical dissociation that is just happening in this kid, we are going to see a lot of ligamentous injury. So next we're going to look at the MRI. So look at this cervical spine MRI. So this is the stir sequence, and the reason I know that because you see the fat is all dark. So you see the signal of the fat is just all dark on the stir, and I know this is the stir sequence, and anything that is bright is just going to be abnormal. So here I'm pointing out to the ligamentous injury here. This is just kind of area of nuchal ligament, just anatomic position that is just injured. You see that this is just a ligamentous injury right there. And then more importantly, you see that this is the tectorial membrane that is just disrupted. So the tectorial membrane is disrupted. And also if I just do that, you see that these distances that we already saw in the cervical spine CT that was widened, now we see fluid and there is widening between the atlanto-occipital joints and also atlanto-axial interval. As you see, there is just widened and there is fluid signal in it. So these are all indication of ligamentous injury. And then if you see, as I said, so you see that there is an atlanto-dense interval also, or atlanto-dental interval. You see that there is fluid signal in it and there is widened. So based on this, we already know that the tectorial membrane is disrupted. We do here another sequence that is very helpful for ligamentous injury, which is proton density, and we can have a very good look at the craniocervical junction ligaments. So if you look at that, this is the C2, this is the C1 lateral mass, and this is the occipital joints up there. And then you see that this is the odontoid process, and then we see here this is the expected location of the apical ligament, which is torn. As you see here, it's right there, is torn, and these are the alar ligaments that they are torn. So basically we already know that tectorial membrane torn, alar ligament, and also we have tear on the alar ligament bilaterally. And if I show you the actual sequence right there, we can look at the transverse ligament, and right here we see that this transverse ligament, which is in the posterior aspect of the odontoid process right there, we see that on the left side is just a little bit like thinner compared to the right side. So you see that this is the outline of the transverse ligament, which is very dark and thick, but the other side is just very thin. So there is at least partial tear of the transverse ligament on the left as well, and that's why we have atlantodental interval is increased and there is fluid in it. So basically this kid has a severe craniocervical dissociation and also all sort of ligamentous injury as we see on MRI. And then in the next video, please follow me. Well, I'm going to talk about the spinal cord injury and different type of collections that you're going to see in the spinal cord. Thank you for your attention.